For more on this, Peter Bernota is an American business executive who has called Wuhan home since August of last year. He has been in Wuhan for the duration of the lockdown and has even blogged about his experience. Peter, it is great to touch base with you again. 6 cases seems fairly low when you talk about testing 11 million people in the span of 10 days. Is that an overreaction, and how will that even work logistically?
Well, it's actually interesting to hear that announcement. The Chinese government right now is trying to determine how they're going to implement that program. Wuhan is broken up into a lot of political districts, a lot of communities. And the announcement actually is to reach out to these communities to come back to the central authority with some sort of a plan to implement testing. Wuhan itself has been in a significant slowdown for quite a while. Obviously, in the course of the intense quarantine measures that were taken, and then subsequently about a month ago with loosening of those measures, the ordinary citizen is still uncertain in how to respond. Restaurants are still not servicing customers. No public venue is really at the capacity it is used to. And I think at this point, the government has made a decision that they need to reassure the population that with some sort of widespread testing, that the conditions are calm and safe enough that they can go out and start reinvigorating the economy here.
So we also heard that China would be re-implementing some measures, some lockdown measures to sort of mitigate the cases that have cropped up in the wake of the easing of those restrictions. Is that the case?
It depends on where you're actually taking a look. Wuhan, of all the communities in China, of all the large cities, has the strictest imposition of quarantine measures. So we are sort of an experimental venue for reopening. It's just not clear. I mean, part of it is that the government itself, while it says that things are coming back to normal, and I see you show some imaging of the recent May Day holiday and then the Youth Day holiday, where people started to get outside and start enjoying the spring weather. In fact, most of the restaurants that are here are only partially open. They can do takeout, they can do delivery, but you very seldom see people sitting in a crowded restaurant as they used to use, sometime in the past. I think part of this is
Peter,
again, you have to establish some sort of, go
ahead. Sorry, Peter, I didn't mean to cut you off. Here in Washington, we heard testimony from America's top infectious disease expert, Anthony Fauci, warning about states reopening too soon and that leading to a resurgence of coronavirus cases here in the U.S. The U.S. continues to now be the epicenter of the global outbreak. I'm curious, as an American living in Wuhan, what would be your advice to people living in states where governors have been more bullish on reopening and perhaps haven't seen that decline in cases that the federal guidance has been issuing to states to wait before entering into that first phase of reopening?
Yeah, I'm not an epidemiologist. I really don't have the expertise to comment about how this disease spreads and how widespread it is within any particular geographical area. The United States is a large country, just like China. China imposed very, very strict measures in Wuhan, which was the epicenter of the COVID-19 epidemic here. It did not continue those measures outside of Wuhan, outside of Hubei province. The United States is, in my opinion, at this point, is in a similar situation. Not every location has a high incidence of infection, though there's certainly a possibility for a spread. If you're in a rural area, if you're in a situation that doesn't have a density of population, you probably don't have to take the same level of response. At the same time, there's also locations that have a higher risk just in terms of mortality rate. That would mean old age facilities of various types, retirement homes.
I think my question, though, like is just from a person-to-person perspective, Peter. A lot of people here have not been wearing masks. It's surprising the number of people. We know that this virus is airborne. There are, I think, a fair amount of Americans in certain states that are pushing to reopen where we're still seeing a surge in cases. And, what would be your advice to just your fellow Americans in terms of, what do you think America can learn from Wuhan?
Personal experience here is just avoid crowds. I mean, that's the simplest solution that you can have. Social distancing, where you have maybe 6 feet or 10 feet of distance between individuals, certainly does have an effect, but it's actually when you have congregations of people that you have the greatest likelihood of spread, apparently. So avoiding crowds. That means that if you want to go out, go ahead, take some hikes, go to the beach, but don't go close to people. Don't go where it's very crowded. As an American here, we're under a little bit more restriction than Chinese citizens, but everybody here actually has to pass temperature checks everywhere we go. Everybody has to have real ID tracking of location in case there is an infection identified. They can track back to where that infection occurred and who else might have been affected, and then they get some testing. Universal testing, which is under consideration right now, as you announced at the beginning of the segment, will definitely identify where there's potential infection points, and then they can respond to that. The United States is a different situation. The United States is very widespread geographically. What will work for New York City will not work for Duluth, or it may not work for Iowa City. And I think that the individual governors and community leaders need to take a look at their communities, see if there's an infection rate, see how much transition these populations have. So, for example, if in New York you have a high infection rate and you have snowbirds, flying down to Florida, Florida can expect that they're going to see a higher incidence of infection. So that has to be taken into consideration as well.
Peter Bernota, it is great to have you back. We really appreciate your perspective as an American and as somebody that has been living in the origin of this pandemic. Thanks for that.